Hi, this is Dr. Andrew Freeman from Walk with a Doc in the Denver area. I was asked today to talk a little bit about lifestyle changes. What the heck is a lifestyle change? So lifestyle is really the way you live. It is the style of your life. And when it comes to medicine, what we're really talking about is diet, exercise, and stress relief. Those are the triad of health that I often talk about with my own patients. And in short, when one works on diet and eats a more plant-based, low-fat, highly nutritious, whole food diet, they feel better. They lose weight. They don't develop diabetes, or they can even reduce the impact of their diabetes. So diet is an incredibly important component of lifestyle. The next thing that we often talk about is exercise. And exercise, of which really should be 30 minutes each and every day, or close to about 150 minutes of brisk activity daily, is critical. So just because you walk around at work, or you walk the dog, or you walk to work, or whatever, these are all things that are not bad and certainly good for you, but not the exercise use as medicine as I'm describing. Really, what I want you to consider is walking to a level that you're sweating, short of breath, and maybe can't complete a sentence. You want to work hard enough after you talk with your doctor and get his or her okay, but hard enough that you can't complete a sentence, that you're really working hard. So this is a brisk walk, and for most people, that's roughly 2 miles covered in 30 minutes. The average human walking speed is 3 miles per hour, so we aim to get a little bit faster at 4 miles per hour, or 2 miles in 30 minutes. And the last, and certainly not at all the least significant, but the most significant, is the mindset. And mindfulness and stress relief go hand in hand, and stress makes everything worse. And holding on to grudges and anger and all these things raise blood pressure, increase the risk for a heart attack, raise cholesterol. Believe it or not, all of these things have been independently studied, and angrier people tend to do worse in terms of health. So as a result, I would recommend that you spend 30 minutes in a quiet room, library, garden, wherever it is that you feel comfortable. Meditate, listen to yourself breathe for 30 minutes, or do some hobby that's unrelated to work that really gets you out of the normal zone that you're in. And use this as a time to heal from all of the day's drudgery, stresses, mean bosses, mean people, and then focus on trying to get those mean people, mean bosses, and other difficult people onto the path of goodness, so that it doesn't affect you in the same way. When you combine diet, exercise, and stress relief, that's what we call a lifestyle modification that is transformative. And so I wish you lots of good luck. It's certainly not easy to do this. If it was, people would do it quickly and we would be out of business. But in short, lifestyle modification is a very ongoing, difficult to master practice that requires enormous dedication, time, and effort. So make Walk with a Doc part of the walking component, and we'll see you at the next walk. Have a good one.